1 in 3 adults over 65 falls each year. And the hip-extensor weakness that drives that statistic is the same muscle group squats systematically underload in older adults. 5 chair-based moves, confirmed by biomechanics research on adults aged 70 to 85, target it directly. Your legs need different physics now, not more reps of the same exercise. Peer-reviewed kinematic research on adults aged 70 to 85 confirms that chair-based movements generate greater hip flexion moments and peak power than standard squats, the very muscles that keep you rising off the floor and climbing stairs independently. Meanwhile, muscle strength after 60 declines at up to 3% per year, according to published Sarcopenia data, making every training choice consequential. This video walks through 5 specific chair exercises, grounded in biomechanics, not gimmicks, and explains exactly why each one earns its place in your routine. Stay to the end. The 5th move is the one most people skip, and it is the one that matters most for fall prevention. Here is what the research actually shows. A peer-reviewed study published in the Journal of Applied Biomechanics had 22 healthy older adults aged 70 to 85 perform both standard squats and chair squats under full motion capture analysis. The finding was unambiguous. The standard squat generated significantly greater knee and ankle joint moments, meaning the knee joint absorbed the bulk of the mechanical load. For a population where cartilage is thinner and joint tolerance is reduced, that load profile carries real consequence. A separate biomechanics review published in the Journal of Orthopedic and Sports Physical Therapy confirmed that exercises shifting load toward the hip rather than concentrating it at the knee are better suited to long-term lower limb conditioning. The chair squat, by contrast, generated greater hip flexion angles and peak hip power. The chair is not making the exercise easier. It is redirecting the load to where your body can handle it. That distinction is the entire argument. Before the exercises, understand what is at stake. Harvard Health data, drawing on published sarcopenia research, reports that muscle strength declines at roughly 1.5% per year between ages 50 and 60, then accelerates to 3% per year after 60. A 2025 ERIC cohort study tracking nearly 6,000 adults found that sarcopenia prevalence rises from 5% at ages 65 to 69, all the way to 36% by ages 85 to 89. That is not a distant cliff. It is a slope you are already on. And the consequences are not abstract. Harvard Health data confirms that 1 in every 3 adults over 65 falls each year, with weak leg muscles as a primary contributing factor. The good news embedded in all of this is that the muscle cells in adults over 65 retain their capacity to respond to resistance training. The body does not stop adapting, it just stops being asked. These 5 moves do the asking safely from a chair. The first move is the sit to stand. You begin seated, feet hip-width apart, hands crossed at your chest. No momentum, no push from your palms. You stand, then lower with control. This is not a warm-up drill, it is a loaded functional pattern. Hinge Health physical therapist Dr. Matos notes that this movement directly trains the muscles used every time you rise from a chair or toilet. The chair here acts as a depth limiter, producing consistent loading at a joint angle your knees can sustain. Aim for 3 sets of 10. The second move is the seated leg extension. Sitting tall, you extend one leg to horizontal and hold for 3 seconds before lowering. Electromyographic research confirms quadriceps activation during knee extension from a seated position is substantial, and critically, patellofemoral joint compression is far lower than during a full squat because body weight is supported. 2 sets of 12 per leg. These 2 moves alone cover the anterior chain, but the posterior chain is where most people are weakest, and that is where the next move changes everything. The squat is a quad-dominant movement, and that dominance is precisely its limitation. EMG research published in 2023 measuring hamstring to quadriceps activation ratios found that the parallel squat produces disproportionately high quadriceps output relative to hamstrings. a muscular imbalance that research associates with elevated knee joint stress over time. Move 3 corrects that. Seated at the front edge of the chair, you hinge forward from the hip, spine neutral, chest leading, then drive back to upright by contracting the glutes and hamstrings. You can hold light resistance, a filled water bottle, or use body weight alone. This move trains the hip hinge pattern from a stable base, loading the posterior chain, glutes, hamstrings, erector spinae, without asking the knees to manage a descent under full load. The seated position removes the fall risk variable completely, which matters enormously for anyone who has noticed balance changes. 2 sets of 10. The posterior chain is now engaged, but the calves and tibialis anterior have not been touched yet, and they are the overlooked architects of fall prevention. Here's a number worth pausing on. Triceps surae, the calf muscle group, is directly involved in propulsion during every step you take and in controlling your center of mass during balance perturbations. Yet the calf is almost entirely ignored in standard squat programming for older adults. Move 4 is the seated calf raise. Feet flat on the floor, you press through the balls of both feet and lift your heels as high as possible. Full plantar flexion, then lower slowly over 3 counts. Published research from GoodRx Health, citing National Institute on Aging guidelines, notes that this movement specifically improves ankle mobility, a variable directly linked to walking stability. The seated version removes calf raise's notorious fall risk. No standing on the edge of a step, no balance demand, while maintaining the full contraction range. A 2023 study in PubMed confirmed that triceps surae hypertrophy is achievable in both standing and seated calf raise variations, making this a legitimate strength tool, not just a mobility drill. 3 sets of 15. There is one move left, and it is the one with the strongest research backing for fall prevention specifically. Terminal knee extension, often called TKE, trains the final 30 degrees of knee straightening, the range controlled almost entirely by the vastus medialis oblique, the teardrop-shaped muscle on the inner quad. This range is disproportionately important. It is the range active during the final push-off phase of the sit-to-stand, during stair ascent, and during the weight acceptance phase of walking, the exact moment balance errors occur that lead to falls. To perform it seated, with a light resistance band looped behind the knee and anchored to a chair leg, you begin at 30 degrees of knee flexion and press to full extension, holding for 2 seconds at the end point. No band, perform an isometric contraction at the same terminal range. Research in the Journal of Orthopedic and Sports Physical Therapy identifies targeted knee extensor training as having specific rehabilitation utility in older populations, precisely because this range is undertrained by squats, which load mid-range most heavily. 3 sets of 15 per leg. This is the move that earns your independence back, and it requires nothing but a chair and intention. Here's how to deploy all 5 moves. Perform this sequence 3 times per week on non-consecutive days. Monday, Wednesday, Friday is the classic structure, allowing 48 hours for the neuromuscular repair that produces actual strength gain. The full session, including rest between sets, runs approximately 25 to 30 minutes. Progression works on a simple rule. When any set feels easy at the prescribed rep count, add 2 reps before you add any external load. That conservative increment protects the joints while ensuring the stimulus continues to outpace adaptation. Over 12 weeks, a 2021 scientific report study on home-based lower limb training in adults aged 68 to 71 documented measurable increases in knee extension peak torque and 1 rep maximum leg press performance, confirming that meaningful strength gains are achievable at this age. In this setting, without a gym. If you completed week 1 on the foundational strength program, this sequence slots directly into your rotation as your seated training day. And when you are ready for the next level, the joint mobility work that unlocks the full range these 5 moves demand, that is exactly where this series goes next.